insurance.
Thank you, Mr. Chairman. I want to talk a little bit about what it was like before the Affordable Care Act was implemented. Before the ACA, 14.5% of Americans were uninsured. After the ACA, it was 8.6%. Because of insurance costs, it crept up a little bit. But then after the tax credits were implemented, it dropped back down to 8.2%. Mr. Cordani, your company offers both ACA plans and administers employer-based health coverage, correct?
That is correct.
Now, prior to the ACA, private health insurance plans were not required to provide coverage for pre-existing conditions like cancer or diabetes. Is that correct?
Madam Chair, we participate in the larger employer market.
No. Before that, before the ACA, the plans were not required to cover these things, pre-existing conditions, right?
In the small employer marketplace, correct. In the large employer marketplace,
Now,
they're covered.
even in employer-based insurance, there could be restrictions like waiting periods on coverage of pre-existing conditions before the ACA. Is that correct?
Congresswoman, in the small employer market,
Correct.
yes.
And plans were permitted to have lifetime benefit limits where if you became too expensive as a patient, they could throw you off the insurance. Is that right?
Yes, it is.
Okay. Now, people might have had to pay also for preventative services to keep them healthy before the ACA had the essential benefits included. Is that correct?
Again, in the small employer market, not in the large employer market.
Okay. Now, today, are your plans in the ACA marketplace or employer plans in large or small markets permitted to engage in any of these practices?
Congresswoman, we cover approximately 1%
No.
of the ACA, and
I
no,
know
they're
what
not.
I
No,
know
they're
what
not.
you do. Are people in the large or small markets permitted to say, no, you have a pre-existing condition, I'm not going to cover you? There are certain requirements in the ACA that everybody has to follow now so that everybody can have insurance. Is that right?
That is correct. The
Okay.
practices in this large employer market are now in the small employer market.
Now, the ACA has succeeded in many ways, but clearly, and we can agree on this on both sides of the aisle, system-wide work is needed to bring down costs for everybody. People on exchanges, people with employer-based insurance, people with Medicare, and more. Enhanced premium assistance built upon what the ACA got right. Capping the cost of premiums in the individual marketplaces contributed to over 24 million people purchasing insurance on the exchanges last year, including Ms. Allen. So, Mr. Markovich, I want to ask you, ACA premium support is calculated based on some of the lowest premiums in the market. Is that correct?
Yes.
Now, if one plan is more expensive, subsidies don't just automatically increase. Is that right?
That's correct.
Okay. And that means that plans have to compete on price, not just sit back and let the subsidies roll in. Is that right?
Yes.
Now, some of my colleagues have said this assistance to middle-class Americans is a handout to insurers. Mr. Joyner, we had enhanced premium subsidies in place in 2024. Is that right?
Correct.
Now, at that same year, the health benefit segment of your business took a $984 million operating loss. Is that right?
Correct.
And so I would say if premium support is a handout, it's surely not a very good one. What premium support is, though, is help to the middle help the middle class afford health care. So I want to ask you, Ms. Allen, when people can't afford insurance, do you think it's worse for the person going without health care or worse for the insurance industry?
It can be catastrophic for the individual going without insurance or delaying the help they need.
So I've got 45 seconds left. Some of you know about my daughter, Francesca. She's a type 1 diabetic. And last summer, and she's a young lawyer, she had a job through her employer. And she called me up. I was listening to you, Mr. Cordani, talk about the insulin prices, but she called me up and she said, Mom, can I put my $1,500 quarterly diabetes equipment payment on your credit card because I'm just having a little cash flow problem this month? And I said, $1,500 quarterly? She had a $6,000 deductible on her insurance. So we have to fix that. You have to fix that, and you all have to be our patience in fixing that, because that ain't going to work for Francesca, and that's sure not going to work for Ms. Allen or anybody else. I yield back.
Generally,